Hello, I'm Sheena Larson, and today I'm going to be talking about canine immune-mediated hemolytic anemia. Immune-mediated hemolytic anemia, or IMHA, is a relatively common immune-mediated disease of dogs. It is an autoimmune disease, which means that the dog's own immune system is attacking its own erythrocytes, or red blood cells. The dog's immune system targets antibodies on the surface of the red blood cells, which leads to the destruction of red blood cells. This can result in anemia where there are not enough red blood cells to provide enough oxygen to the dog's body in as quickly as 3 days. Unfortunately, IMHA is considered to have a poor to guarded prognosis. It has a relatively high mortality rate where thromboembolic complications are the primary cause of death, that is, where a blood clot blocks the flow of blood in a blood vessel. Pulmonary thromboembolism, where the blood clots are blocking the vessels in the lungs, are reported most often, but blood clots can form elsewhere in the body. Most deaths are seen within 2 weeks of diagnosis. IMHA may present in a variety of ways, which I will cover later on in this presentation, and it can occur in animals of any age. However, it is most often seen in middle-aged female dogs. Red blood cells are destroyed through intravascular hemolysis or extravascular hemolysis. Intravascular hemolysis involves the complement system, and extravascular hemolysis involves phagocytosis in the spleen and liver. This is a diagram I made to show the very simplified process of intravascular and extravascular hemolysis. For intravascular hemolysis, which is called intravascular because it occurs in the blood vessels, you can see how antibodies attached to the surface of the red blood cell attract blood proteins through the complement system. These blood proteins create membrane attack complexes which cause the cell to rupture or lyse. For extravascular hemolysis, which is called extravascular because it occurs outside of the blood vessels in the spleen or liver, the antibodies attract certain white blood cells called macrophages, which engulf the red blood cell and digest it. I have made a little demonstration to show what effect hemolysis can have on the blood. So the blueberries represent the red blood cells and water represents the plasma. See how they're all floating nicely and the water is clear. Now with hemolysis, where the red blood cells are being broken down, as represented by the mashed berries in the glass, you can see how the components of the red blood cells mix with the plasma and there are fewer intact red blood cells to function. The destruction of too many red blood cells can cause a buildup of both hemoglobin, which is the protein responsible for oxygen transport, and bilirubin, which is the orangish byproduct of hemolysis. Excess hemoglobin in the blood can damage the kidneys. An excess of bilirubin can overwhelm the liver, where the liver cannot process it all. This may result in jaundice, where the skin, whites of the eyes, and mucous membranes have a yellow tint. All of this information that I have gone over applies to IMHA regardless of cause. However, we can differentiate IMHA into two different types, primary and secondary, based on whether IMHA just occurred or if it occurred as a response to something else. With primary IMHA, most cases are idiopathic, where the exact cause is unknown. With secondary IMHA, the body starts attacking the red blood cells as a response to other stimuli. These stimuli can include medications, infections, neoplasia, other immune-mediated conditions, and vaccinations. However, there is limited support in the literature that vaccines can cause IMHA. Dogs with secondary IMHA can also show signs from the causative disorder, and secondary IMHA may not resolve until the underlying disorder has been resolved. IMHA can present in different ways, but some common clinical signs include icterus, lethargy, fever, pale mucous membranes, tachycardia, anorexia, bilirubinuria, which may result in urine that is brown or orange in color, vomiting and diarrhea. In some cases, there may also be enlargement of the spleen and liver. I have included a photo showing a very pale and jaundiced mucous membranes on a dog. These clinical signs can indicate different processes which are occurring in the dog's body. For example, bilirubinuria and icterus can indicate that hemolysis is occurring within the dog's body. Pale mucous membranes, tachypnea, tachycardia, and a systolic murmur can indicate anemia. And fever can indicate a heightened immune response. Before we get into different diagnostics used to diagnose IMHA, I want to point out that there are different classes of anemia. This is important because treatments and prognosis may differ. So not all anemias are treated equally. Anemia is classified into regenerative or non-regenerative based off of how the body is responding to the loss of the red blood cells. We can do this by quantifying the number of immature red blood cells or reticulocytes. Regenerative anemia is where the body is reacting to the loss of red blood cells by producing more, so there's a higher number of reticulocytes. Both blood loss anemia and hemolytic anemia are generally regenerative, and they can further be distinguished through other findings. Wow. Non-regenerative anemia is where the body is not able to respond properly to the loss of red blood cells, and there's a lower number of reticulocytes. However, it is important to keep in mind that IMHA may present as non-regenerative or pre-regenerative if the blood is examined too early, and the body has not had enough time to start producing reticulocytes, or if the immune system is targeting erythroid precursors. There is no standardized testing for IMHA, but usually blood is collected and examined for abnormalities. These diagnostics include blood smear examination, a complete blood count, or CBC, which quantifies the individual cell types and is commonly used in conjunction with blood smear analysis, saline agglutination, and Coombs test. I have included a photo showing a blood smear being examined on a microscope. When there are signs of hemolysis, it is important to determine that the hemolysis is occurring within the dog's body and that it was not a result of poor blood collection or handling. Ex vivo hemolysis can skew the results of diagnostic tests. With IMHA, these tests may show low packed cell volume, or PCV. I have made a diagram here showing two microhematocrit tubes and what a low PCV, or anemia, looks like compared to normal blood. When examining a peripheral blood smear, you may observe spherocytes, where some of the red blood cells appear smaller and darker, and agglutination, where red blood cells are clumped together. I made a visualization of agglutination here. You may also see an increased number of white blood cells, leukocytosis, or a decreased number of platelets, thrombocytopenia. I have included a photo here of what spherocytes look like under the microscope. They are circled in red. These diagnostic tests are used to look for certain abnormalities. If you are looking for agglutinates, you can perform the saline agglutination test. If you are looking for the presence of anti-erythrocyte antibodies, you can perform a Coombs test, saline agglutination, or flow cytometry. The direct Coombs test, also known as the direct antiglobulin test, or DAT, is commonly performed when the veterinarian suspects IMHA. There are many different ways to perform a Coombs test, which may affect the sensitivity of the results, but they generally follow similar steps. First, the blood sample is rinsed to get rid of unbound antibodies. Then specific antibodies, Coombs reagents, are added to the sample, which will bind onto the antibodies on the red blood cell. These bonds will cause agglutinations in a positive test. I have created a diagram which shows a simplified visualization of a direct Coombs test. You can see how the antibodies of the Coombs reagent bind with specific antibodies on the red blood cells to form agglutinations in a positive test, whereas they do not react when the test is negative. Because there are variations to how IMHA presents and false negatives occur with every diagnostic test, multiple diagnostic tests should be considered. Some additional tests recommended by veterinarians include urinalysis, biochemistry panels, radiographs, ultrasounds, screening for parasites, bone marrow evaluation, and coagulation tests. Once a dog has been diagnosed with IMHA, a plan needs to be made for all treatments that the dog will receive. There is no singular regimen to treat IMHA. There is significant variation in the types and duration of treatments prescribed by veterinarians. I will go over the most common ones. However, the response to treatments is variable between each animal, and unfortunately, deaths still occur in animals receiving treatment. Some common treatments include blood transfusions, immunosuppressants such as prednisone or prednisolone, thromboprophylaxis using blood thinners such as heparin, splenectomy, and supportive care. Supportive care is very important for short-term survival and can reduce the effects of shock and renal failure. Blood transfusions are used to replace the lost components of blood and can improve the transportation of oxygen throughout the body. However, some dogs may experience a transfusion reaction. Therefore, dogs receiving a blood transfusion has to be monitored carefully for signs of an adverse reaction, including fever, tachycardia, tachypnea, hives, pruritus, erythema, vomiting, and diarrhea. Immunosuppressants are drugs that suppress the immune system. For example, glucocorticoid products such as prednisolone. It is important to know which type of IMHA the animal is suffering from, because immunosuppressants are used to treat primary IMHA, but they may make secondary IMHA worse. It is important to know that steroids can be very effective when treating IMHA, but they have to be used with caution. The dog may develop hypoadrenocorticism, Cushing's disease, or Cushing's syndrome, with long-term use, and they can make concurrent conditions such as heart disease worse. Steroids have the potential for severe side effects, including polyuria, polydipsia, polyphagia, muscle weakness and atrophy, skin alterations, and thromboembolisms. Other immunosuppressants can be used in conjunction with glucocorticoids to lessen the chance of negative side effects occurring. Some examples of these other drugs include azathioprine, cyclosporin, and leflunomide. However, these drugs may be hepatotoxic, cause damage to the kidneys, and immunosuppressive drugs increase the occurrence of opportunistic infections. Splenectomy, or the surgical removal of the spleen, can be a treatment for IMHA because the spleen is a common site for extravascular hemolysis. Its removal may reduce the destruction of red blood cells. Finally, thromboprophylaxis, or blood clot prevention, uses anticoagulation drugs like aspirin or heparin as a preventative to treat symptomatic animals. Do you guys have any questions?
No.
So here are the references that I used for my slide or my presentation.